Okay, on these several slides, we're going to look at parts of the brain and spinal cord. And on this one, we're seeing a posterior view. Just to cover a few basics, the cerebrum, cerebellum, brainstem, spinal cord all the way down to the conus medullaris, which ends at L1, L2. The rest of it is the cauda equina. We have the cervical part, thoracic part, lumbar part, sacral part. And then here you're seeing that in more detail. The cervical nerves, thoracic nerves, lumbar nerves, sacral nerves. The cervical nerves are C1 nerve root through C8. Okay, so we have 8 cervical nerve roots, and I do want you to know what they function in general. So in general, your neck nerves function head movement, neck movement, shoulder, upper limb. Okay, so it makes sense. You know, your neck bones don't necessarily, your neck nerves are not necessarily going to move your toes. That'll be more of a low back function. Okay, so they're almost level appropriate. So neck nerves, head, neck, shoulders, arms, upper limbs. Okay, thoracic nerve roots, they come out and innervate and help you with breathing, vertebral column movement, posture muscles, heart, lungs, the vital organs within the thoracic cage. So the nerves come out and innervate different vital organs inside in the thoracic nerve area. And the lumbar nerves, L1 through L5, they are going to help with basically bowel and bladder function, your lower limbs, so your legs, reproductive function, digestion. So the nerves that come out of your low back innervate lower body stuff. Okay, and then the sacrum will be also bowel and bladder, reproductive, and lower limbs. Okay, and here we're seeing the brachial plexus. Okay, C5 through T1. And here is the lumbar and sacral plexus. So that's going to be low back function, leg function, and all that. Okay, so here's some dermatomes. I did post a video on the dermatome, so please take a look at that. I also posted some videos on our spinal reflexes with a reflex hammer and the neurological exam done in like 4 minutes. So please take the time to watch those. Some of the stuff that I've talked about, those of you who have been in class, and we went over cranial nerves and direct pen light, pupil reflex, reflex hammers, sensory with the Q-tip and pinwheel and that kind of thing. So I've got a lot of that posted. Knowledge of your dermatome patterns that you're seeing here is also important. So a person can come in and they'll point to this area, the C5, and say, this feels funny. It's numb, it's tingly, sparkly, whatever. Everybody has different adjectives to describe what's going on. But nevertheless, those are some areas you'll want to assess. And you can muscle test it, use your Q-tip, which would be tactile, sensory, or your pinwheel, which would elicit the pain fibers. Okay. Also, the reason why they have like C2, C3, C4, C5, C6, and then in the chest area T2, T3, on the posterior side here T4, T5, T6, and all of these things that you're seeing, as you probably can tell, the reason why they have those names is because that's the area of the spinal cord it comes out. So let's look at, we'll pick on this one for example. Okay, T8. So your T8 nerve root, which is thoracic bone area number 8, and its corresponding disc, well, the nerve root comes out and innervates that particular dermatome pattern. So if anything happens to that specific part of the thorax, which on the posterior side is there, on the anterior side is there, okay, there's T8 on the front. Person comes in, let's say a good example would be shingles. Okay, so shingles surfaces and irritates that particular dermatome where they have the rash and so forth. Then you can imagine T8 nerve root ganglion is upset, is infringed, is pissed. So that's why the virus surfaced, which is a herpes virus, and went down that particular dermatome. Now that can happen anywhere. It could have surfaced here, which if it did, it would have gone down this area. Could be one side or the other, or both, and on it goes. Okay, now let's talk about herniations. So typically herniations, the most common are going to be in your low back, your L3, L4, L5. They're common down there. And then in the neck, C5, C6, very common area. Now, herniations can happen anywhere. They're just very common in the neck area and cervical and lumbar. Okay, so let's say you have an L4 herniation on the right. So the disc, nucleus propulsus, herniated and went posterior lateral to the right at L4. So there's a good chance this is the area, that L4 area, they're going to feel it. Okay, there it is. So the L4 area, they're going to feel it. Likewise, let's say it was C6, cervical herniation, then that nucleus propulsus and all that's going to bulge, press on the nerve root on the right side and hit that area, the C6 area. So that's where they would have sensory issues or whatever. You'll come in like it hurts here, it's numb here, it's tingling here, something is symptomatic, and it follows that specific dermatome because it comes from that specific nerve root in the neck or the low back. Okay. So understanding your dermatomes will really help you help patients from a medical standpoint to differentiate, is this a herniation causing it? Is it surfacing of a virus causing it? Or whatever. There's different things that can cause infringement on nerve roots, and ganglion, and one of the evidence is it follows these dermatome patterns. Okay, on this one we're going to map out the spinal cord. Okay, so let's rotate this till it gets, there we go. All right, so let's name some parts. Okay. This will be the anterior side, and this will be the posterior side of the cord. So this is a cross section of the cord. So you're taking a long spinal cord and you've basically cut it in half, right, in the transverse plane. When you look inside, you're going to see there's the gray matter. Okay, this stuff here. That's the gray matter. The H, or the butterfly looking thing in the middle. Everything else is the white matter. We've already identified the back side, the front side, okay, posterior, anterior. And here's the right side and the left side. All right, this is the ganglion. Also, this whole thing on the posterior aspect is a sensory nerve root. And this one in the front is a motor nerve root. Okay, so the posterior branches there are going to be sensory, and the anterior are going to be motor. Likewise, the posterior aspect of the cord in general is sensory in, and the anterior part is motor out. Okay. Now I'm going to finish the rest of it here on another lecture, because it's going to get quite detailed and lengthy. So we're going to pause there and pick up on the next slide.